Hi, my name is Luciano Costa. I'm a multiple myeloma physician at the University of Alabama at Birmingham. And at ASH 2025, I had a chance to present the long-term progression-free survival benefit of cilta-cel in patients with standard risk relapsed refractory multiple myeloma. As many of you will recognize, CARTITUDE-4 was a randomized trial for patients with lenalidomide refractory myeloma in 1 to 3 prior lines of therapy, where patients receive daratumumab, pomalidomide, and dexamethasone, or pomalidomide, bortezomib, and dexamethasone at the investigator's discretion until progression, or they receive this one of those same regimens as a bridging therapy, followed by infusion of a single infusion of cilta-cel, an autologous BCMA-directed CAR T cell. So this study has been published and presented, showing overall progression-free survival and overall survival advantage for the cilta-cel arm, really changing the landscape of therapy of multiple myeloma and the approved indications in the US, Europe, and many other places. Because of this therapy has some complexity and some unique toxicity, oftentimes physicians default to use this therapy, particularly in patients with high-risk disease. So the emphasis of this abstract was to really describe the impact of this therapy in patients with cytogenetic standard risk disease. So those are patients who do not have a deletion 17p, translocation 1416, or translocation 414. And there were 69 of those patients in the cilta-cel arm, or 70 of those in the standard of care arm. And there was, of course, a progression-free survival and an overall survival advantage favoring cilta-cel. But perhaps more intriguing is if you compare those patients with patients with a standard risk cytogenetics in the CARTITUDE-1 trial, which was a trial that was patients with 3 or more prior lines of therapy, triple class exposed. And for that, you would also include the 1Q gain because that was part of the standard risk on CARTITUDE-1. So you have now 71% of the patients alive and progression-free at 30 months. It will be 80% if you take out the 1Q. And that is a sharp contrast with the 60% that you saw on CARTITUDE-1. Perhaps even more intriguing is the duration of those responses. If you take the patients who are progression-free after 1 year with standard risk disease, okay, and 93% of them remain progression-free 30 months. So at essentially at 18 months later, despite the fact that they have not received any further therapy. So when you look at MRD at those patients at the end of 1 month, at the end of 1 year of therapy, from therapy, 81% of the MRD evaluable patients are MRD negative, and all those patients remain progression-free at 2.5 years. So I think this study highlights very clearly that even though sometimes we prioritize higher risk patients for this therapy is transformational, inclusively and perhaps particularly on patients with standard risk disease. Even on the CARTITUDE-1 population, we start having a glimpse of cure with that 1/30 of the patients not progressing after 5 years. And by our measures, it looks like we're going to see a similar phenomenon in patients on the CARTITUDE-4, particularly those with stable, with standard risk disease. So for these patients, this really represents an opportunity to perhaps have a one-time definitive therapy. Thank you so much.